a Psych Eval. It's a little bit more comprehensive than the Psych Update, and I'm going to walk you through it. So when you're getting into your schedule, and the person is scheduled, you're going to begin the session. These are the components of the Psych Eval, and also this is going to look like the Psych Update, but it's going to be less comprehensive. So the history is really going to be person is present and other person's present. So if there's going to be a guardian, a parent, you're going to list that person in here as identified in the session. For Polk County, we typically do a mental health assessment before they are seen by a nurse practitioner. So you're going to typically put yes, clinical assessment is completed. You can go back into their schedule and see that it is completed and also refer to it during this meeting. This is your HPI. So as you can see, I just clicked on that, and you can get more room here for your HPI. It's going to be the symptoms, current symptoms. This is your drop-down box for mental health and treatment history. For this assessment, you're always going to have additional history indicated. So it's going to be mental health history and treatment that's most likely outside of this agency. So if you get records and can review, they've been over at another agency, they were seen as a child, you're going to want to put this in here when symptoms first occurred, or however you do your clinical workup. These two boxes right here, it's going to auto-populate from the EMR med list. So your allergies and current medications, when you do put in medications, and Dana's going to show you how to do that on the webinar. When you do, this will auto-populate. Prior medications, this is stuff that's not on the EMR. It's going to be medications that they took that, I typically do. So took Zyprexa, wasn't helpful, caused, weight gain, 30 pounds. So I'll place this in here as kind of a guide. If you don't want to do that, you can also put it into your mental health history. You're not required to use these boxes, but they are helpful to kind of format your eval. This is where we put in the social history, family history. Family had any symptoms of any mental health history, neurodevelopmental history. We're going to be using this a lot for our kids and our DD folk. History of symptoms, review of symptoms. This is also with the M&Ms, the med management sessions. We put in this, and often we're just going to be clicking these two. However, a lot of times I'm doing endocrine. I'm clicking on cardiovascular because I'm asking those questions. Past medical history. This is going to be kind of their medical workup that you've reviewed by PCP, and the goal is to have PCP records before the eval so you can review them. Client has thyroid condition, last labs, last immunizations. This is where PCP is at, but it's also going to populate on the client screen. Substance history. This is also a drop down. I don't use all of this, but you can if you want. It's available to you. I will often just say substance history, and I'll go through and I'll make kind of like a narrative. It's up to you. So you're going to press complete after you're done. Exam. We have two options here. We can either do a mental status exam by narrative. You can do your own. And at Polk, we can provide you with kind of a template for that. We have it. Or you can do just boxes with a small narrative if you want. That's up to you. So it gives you these options. Orientation, insight, musculoskeletal, and then complete. Risk assessment. This is something that's required for the state. We're going to be asking these questions and going through it. You don't have to go into detail on it unless we've identified that there is action and behavior, or there is a plan in place. So does the individual report current or past thoughts of suicide? You can put that in there. But see the little red asterisk, it means we have to say something. So none of the above, we're reviewing. And this is kind of an addition, is level of risk. After you've gone through these questions, what's their level of risk? Of harm to self? None. Others? Low? None. And then click on it. This one is it's a two-step part for an evaluation, because you're developing a diagnosis eval, and you've decided you have major depression as the diagnosis. You're going to come into this screen, and you're going to see a therapist diagnosis or A&D counselor. We can't use those. They're going to populate right here, but they're going to say another prescriber's name and a date. What we need to do is go into client intake, which is a button right up here. You're going to click on this little stethoscope, and there's going to be the current list, and you're going to want to go up here and start a new diagnosis. So this is a you've decided depression is, and this is the new DSM-5, and you want to stay within that DSM-5 for billing. So you've decided it's let's just go with the top one, adjustment disorder with depressive mood. This is going to want to be your primary, meaning you're overriding the other ones for the purposes of your billing. You're putting in your note, I'm just going to put in my initials for right now. You can put in your full name. And onset prior to admission, I'm going to say yes. Medication management is our role, so I'm going to default this program. And really, you can fill out these some people put in long notes. You'll probably not have that much time to do that. You can always do also a rule out right at the bottom here. They have that. And save. So your code, your section right here, your diagnosis section is going to pop up for you. And we're going to go back so we're going to go out of this and back into the diagnosis section. And we're going to see us right here. And I know this seems kind of weird, but you're going to verify that this exists still. And you're going to paste. So, summary of diagnosis. You're just this is for populating onto your document when it prints out. And it says, I have reviewed recent diagnostic updates from clinical record. So you're completing it as yes, this is still the condition. This is referring to services. They require this section to say, are you referring to outside services or inside services? Even if you're not, you have to press none. And PARQ. Had you done that? If you had not, you don't have to click on it. Residential services recommended. We don't typically do that. We have services for that, which Dana can explain in the webinar. And so bypass through that. Does client meet medical necessity for psychiatric services? If you are starting services with him, you're going to say yes. Really, this part right here is optional. This is already put in below in your plan of care. You can clarify this if you want to put it in, but it does waste a lot of time. This is where your summary is going, your impression and your plan. So impression, 25-year-old white female or male, and then plan. What's your plan? Requesting records. Are we starting a medication? Are we continuing a medication? So that's all going to go right here. That's why I'm saying it's kind of a repeat treatment plan. So you can keep it right here, more formatted, or you can put it into this summary, however you want. And this is just verifying individual response. Understands information and agrees to medication, refuses medication, however you want. And then if there is a guardian present, if you identify that other person in there, not a caregiver, but a guardian, that they have agreed to medication. Polk County is going to identify guardians and have guardian paperwork in our attached file for you to review. So if that's actually the case, then you'll have that for review. This is going to be our billable services code. It looks like 1, 2, 3, 4, and 5. They're the E&M level codes. We do not deal with 1 and 2. 3 and 4 is going to be the 99213 and the 99214. So our evals are always 5. We're always clicking on 5. Interactive complexity. This is something that's an add-on. So if a person meets criteria for interactive complexity, it's a billable service and an add-on service. So you have a clinician needing to manage anger, crying, kind of a difficulty communicating that keeps you from doing your assessment. Also caregiver emotions, evidence of disclosure, or needing equipment to communicate with a person. A lot of times our kids, clinicians are going to need a lot of this. They're going to bill for this. Or people in group homes, or people with mood disorders that are manic when in session. You're going to bill for that. And supporting documentation. At this point, you don't need to go through a huge list of why, or you can say CHPI, client agitated due to mania, and then complete. Telemed. If you are under telemedicine, you're going to press yes. If you're not, you're going to press no. You're going to go ahead and complete. So you're going to look through here. It's going to identify in these bold things saying, you forgot to document on these. And then you'll go back and do that. This right here, co-therapy, can be a yes, because co-therapy is counseling coordination of care. Counseling and coordination of care is teaching about medications, teaching about vitals, teaching about anything, or therapeutic listening. For our 99214s and our 99215s, we are usually always doing that. If we're not, you can press no, but for most of our 99214s and our 99215s, in some fashion, we are providing that education, that teaching. But it's at your clinical discretion whether you pick. So, looking through here, I'm identifying date of service. Yeah, that's always going to auto-populate correctly, but this is the times that you've met with the patient. Average. If it was an hour, really you cleaned up in about an hour. This is an average of what time you're doing. You're going to round. You're not going to do to the minute. And you're going to put in your password and submit.